to call the meeting of the Minnesota Senate Health and Human Services Committee to order. It is Wednesday, February 19th, 2025. And we do have a quorum present. Today we will be hearing about various hunger initiative bills and addressing food insecurity in Minnesota. And all of the bills include appropriations, and so we will be laying them over for possible discussion and inclusion later in session. We wanted to group them together today to get an opportunity to kind of get a overall picture of work going on in Minnesota related to food insecurity and the various entities that are working on addressing needs, and then the individual bills discussing some of the individual initiatives that are going on. So first, we will hear a presentation from Second Harvest Heartland and the food group. And welcome to the committee. Mr. Rodwald, are you going to go first? If you could please state your name for the record and begin your presentation.
Will do. Thank you. Thanks, Madam Chair, members of the committee. My name is Zach Rodwald. I'm the Director of Public Affairs for Second Harvest Heartland. We're a food bank based in Brooklyn Park. We serve 41 counties in Minnesota, 18 counties in western Wisconsin. We're the third largest food bank in the country. And for those who are maybe less familiar with the Hunger Relief Network and how the system works, food banks like the food group, Second Harvest Heartland, and others are essentially the wholesalers. We source and distribute food to food shelves, food distribution programs. And in our case, we work with over 1,000 food shelves, food distribution partners in our service area to provide healthy, nutritious food to folks, neighbors in need. And so I'll go through this presentation here quickly and happy to answer questions at the end. But a year ago, we launched an initiative called Make Hunger History, which was kind of a community call to action to bring together folks from the Hunger Relief Network and outside of the Hunger Relief Network, including in the private sector, public policy makers, and others to cut hunger in half in Minnesota by 2030. And what we have seen over the last few years, as you'll hear in our testimony today, is a dramatic increase in need for emergency food in our state. And we're happy to have the opportunity to talk a little bit about some of the solutions that we see for that today. But one thing that we realized as we launched this project was that the data that we had available to us was not reliable. The USDA figures that measure food insecurity traditionally in our state are over almost 2 years old by the time we get that data. It's not based on a wide sample of Minnesotans, and it didn't reflect what we were seeing at the food bank, food shelf level in terms of increases in needs over the last few years. So we launched a new survey. We partnered with Wilder Research. This is a household survey of 20,000 randomly selected households throughout the state. Very happy with the response that we got and feel very strongly that this data is valid and can be trusted, and it gives us a lot more detail, a much more detailed look at what is happening with hunger in our state. And the headline here is that 1 in 5 Minnesota households are food insecure, meaning that they weren't able to receive enough food without assistance, and in some cases got no assistance at all. So that's a full 20% of Minnesota households, which is a much higher figure than we've discussed in the past or seen in previous surveys. And the approach in this survey was a little different than what you might see in others. We know that hunger is a continuum. It's not a switch that flips on or off, and people can move in and out of the Emergency Hunger Relief Network over time. In fact, it's designed to be there for times of need. And we were able to discern a little bit more about the experience that people are having in our state. And so as you can see on this slide, 2% of the state reported that they did experience hunger. They did not have enough food in the past year, and they did not receive any emergency food assistance. They did not visit a food shelf or weren't able to for any reason. They did not receive any benefits from public assistance programs like SNAP or WIC or anything else. So that's 2% of the state. 5% of the state were in this second stop where they also reported having experienced hunger in the past year, but they did receive some services. They were able to visit a food shelf occasionally or received some assistance in getting food. The third stop here is one that is new to the conversation and one that we spent a lot of time exploring and thinking about how we can support these folks. 13% of the state reported not having experienced hunger. They had enough food in the last year, but only because of the Hunger Relief Network and because of hunger relief programs like SNAP and WIC and other food assistance programs. So that's 13% of the state that the Hunger Relief Network is meeting their needs in terms of emergency food, but those folks are not able to afford food on their own without assistance from the Hunger Relief Network. And so that is a total of 18% of the state that the Hunger Relief Network is, 18% of households throughout the state that the Hunger Relief Network is supporting. And no surprise to those who follow this that it's not felt evenly across all households. You can see on the left-hand side of this slide the figures that I just walked through. But when you look at households in which English is not a primary language, only 48% of those households are reported being food secure. For households that included at least one person who identifies as a person of color, 60% of those households are food secure, only 60%, and of households with children, that's 74%. And I will make mention that Universal School Meals was not asked about as a food assistance program that people would benefit from because it is a universal benefit, and so that would have had people reporting using food assistance, and so this does not factor that. So it's important to know that this is what is left with that. There's also maybe a little surprisingly, very little variation in how hunger shows up throughout the state. In other words, it's a consistent challenge in virtually every corner of the state. There is some movement in the different stops on the continuum, those regions that are highlighted in the Northwest, the Northland, and the Southwest. These are the regions that Wilder Research uses for their survey data, and so it makes it easy to compare to other data that we have. But if you look at Southwest Minnesota, for example, you see many more people in that third stop, in the Northland as well. So we are able to look at a little bit more granular level what's happening, what people's experience are. In some cases, it may be that the distance between where they live and where the nearest food shelf is too great, or they don't have access to transportation. It could be that benefit amounts are not high enough to be able to escape food insecurity. There's a lot going on underneath this data, and we look forward to getting into that more in detail with anyone who's interested another time. But again, 18% of the state right now is being served by the Hunger Relief Network, and a majority of the folks that we serve did have all the food that they needed. When you look at the resources that they are receiving, these are of the folks who are receiving some kind of assistance. 5% of those folks were getting assistance that was neither SNAP, formerly known as food stamps, or food aid. So that a lot of that I think is WIC and some of the other smaller food programs. 13% of those folks received only SNAP benefits. 29% received food aid and SNAP benefits, but the majority received their food from, just over half received their food from a food shelf. And what makes this especially challenging is that this is not the peak. We don't believe that we have hit the peak in demand. We have seen record-breaking years, and you're going to hear more from my colleague Peter here in a minute on this. We have seen record-breaking years in the last 3 years for emergency food demand in our state, and there are changes underway in Washington, D.C., which could make our challenge in serving people and getting people the food that they need even more difficult. And another thing that I would flag is that of the 80% of households who are food secure, 20% of them reported being concerned about being able to afford the food that they need in the year ahead. And so that uncertainty and anxiety is being felt by people, even those who are able to afford their groceries and the food for their families today. So we've set this goal, as I mentioned earlier, of cutting hunger in half. What that means is that if we're successful, and by we, I mean the collective we, our state, if we're successful, we will see 90% of households be food secure by 2030. That's our goal. And we look forward to getting into some of the solutions that will help bring us there in the years to come, including in this legislative session and a number of the bills you'll be hearing about today. With that, I'll be happy to answer any questions, or we can move to Peter's presentation.
Thank you. Maybe we'll have Mr. Wojtek, maybe you can do your presentation and then we can open it up for questions. Please, welcome to the committee, and please state your name for the record and begin.
Thank you, Madam Chair and members. Peter Wojtek, Government Relations Manager with the Food Group. And before I share the data, I just wanted to briefly underscore the crucial point that Zach made too about the difference between food banks and food shelves, both obviously being vital to the hunger relief system. And as Zach said, food banks are the wholesalers. They're distributing the food to food shelves. Food shelves are kind of the boots on the ground, local organizations that directly impact support for individuals and families in need, and are often that lifeline during times of crisis. Food banks offer some food, some of that food is free through the state and federal supports, but the rest of that food shelves typically purchase. And primary way they do that is through the state grants, through the Minnesota Food Shelf Program. So as you can see on this slide, food insecurity remains a persistent problem in our state. Last year, food shelves saw nearly 9 million visits, which is up from 7.5 million in 2023. And prior to that, it was 5.5 million in 2022. Before the pandemic, Minnesotans were making around 3.5 million visits to shelves per year. So it's gone up significantly since 2021. The number of food shelf visits are really a measure of the size of the response of hunger. And so, as Zach mentioned, hunger is now measured in multiple different ways. And so the 9 million visits tells us that someone in Minnesota showed up and they got help at a food shelf 9 million times in 2024. That number also indicates and shows really the response of how the network of food shelves have stepped up and expanded their services to meet the needs of the communities throughout Minnesota amid rising inflation and, of course, especially the increase in food prices. And this next slide is just broken down further by category, and just wanted to highlight that the fastest growing age group of visitors to food shelves are children. Child visits increased by just over 19% in 2023. Adults were up 18% and seniors just under 12%. So total visits up almost 18% from last year. And so these stats aren't just numbers, they represent real people, our neighbors, our friends, community members who face the daily challenge of having enough food to eat. And that's why it's crucial that we have programs like the Minnesota Food Shelf Program, or MFSP as it's called, a critical source of support to food shelves throughout the state, funded by the state legislature, established back in 1992 to support food shelves throughout the state and reduce food insecurity. And since its beginning, we've partnered with the Department of Human Services, now Children, Youth, and Families, to distribute those funds to food shelves around the state. It's a non-competitive grant that programs must apply for and report to annually. The majority of those funds are distributed on a proportion of the number of visits that food shelf saw the previous year, and the amounts range from anywhere from $7,500 to a maximum of $150,000, average being around $25,000 per food shelf. Reaches every corner of the state, allows food shelves really the flexibility to use those resources where they need it most. So in most cases, like I mentioned, it's used to purchase food, but it could be used for utilities, personnel, transportation, getting food to people who have mobility transportation barriers throughout the state. So increasing funding and support to food shelves and other investments that we're talking about today in the emergency food system are not just a compassionate act, it's a strategic investment in the well-being of our state. So adequately funding shelves can increase inventory of fresh produce, dairy products, proteins, ensuring that recipients have access to a well-balanced diet. They can also offer more comprehensive services, allow food shelves to remain open and help meet the needs of those who are struggling, and be better equipped to respond to emergencies, sudden surges in demand, and providing critical support when it's needed most. And you'll be hearing from other testifiers here today who will highlight the importance of continuing this investment amid the rising need, and by doing so, I think we can make a tangible difference in our state. So appreciate the time to testify and talk about this need.
Thank you very much. Members, do you have any questions for these presenters? Senator Mann?
Thank you, Madam Chair. Thank you for the presentation. Thank you for being here. Mr. Rodvold, did I say that?
Rodvold, yes.
Rodvold.
Thank you.
You had mentioned challenges in Washington that would make feeding Minnesotans worse. Can you expand a little bit on that? What are we expecting to see, or what are we seeing that would make feeding Minnesotans more difficult?
Mr. Radvold.
Madam Chair, members, Senator Mann, thank you for the question. Congress is in the middle of, or at the beginning of, a budget reconciliation process where they're going to be looking at federal spending and sort of across the board and putting together their budget and spending bills. There, as it relates to federal nutrition programs, SNAP is by far the most effective. It's the largest hunger relief program that we have. To give you a sense of scale, for every meal that a food bank provides, SNAP provides 9 meals. And the budget instructions sent in the Senate to the Agriculture Committee call for $1 billion in cuts to the Agriculture Committee's budget. In the House, it's $230 billion. And the only place to get that kind of savings in the Agriculture Committee would be from federal nutrition programs. And so that's quite a wide range, $1 to $230 billion, but any cuts to SNAP benefits will drive more people to food shelves. That is the direct result of cuts to benefits. There is not another place to go when you lose those benefits. And keep in mind the financial impact that SNAP has on retailers and local economies, especially in greater Minnesota, where you've got smaller independent retailers and grocery stores. That's $1 billion plus out of Minnesota's economy that flows into those grocery stores. When those go away, people are going to food shelves and getting their food for free, and therefore, of course, they're not putting money into the local economy. And so there's a doubling of that impact. For every dollar of SNAP spending, $1.50 is returned to communities, is I think the average return. But our concern is more for the neighbor, the person who today is using SNAP to feed themselves and their families. And if those benefits are cut, then that will exacerbate, it'll turn what is right now a crisis into a catastrophe.
Senator Mann? Senator Curran.
Thank you, Madam Chair. So I'd be curious, so we've seen a significant growth. It's exploded over the last 4 years. So we've seen the economic conditions and the cost, and would love your perspective on why so many hardworking legal U.S. citizens are struggling to have, we're talking about working people that are struggling to feed their families. And so the policies over the last 4 years are the cost of living in this country, and we've had low unemployment, right, statistically low unemployment. And the harm done by the last 2 years of the fiscal policies in this state, what role do you think they're having in the increased cost or the inability to meet the average food needs of a family who are here working their tails off? And yet, what do you think are the contributing causes? You just described what could potentially be impactful. What's driving it here? What's driving that vast increase? The cost of living is hurting every hardworking legal U.S. family. And so we'd love your comments on that.
Mr. Wojtak?
Thank you, Chair and Senator. Yeah, I think there's a number of factors. That's a good question. I think the inflation and just the rising cost of food and the wages just haven't kept up with what people are seeing and experiencing out there. That's a lot of what we hear. And coming out of the pandemic, there was some supports put in place to help out folks, especially on SNAP, and there were higher benefit levels. And when those went away, we saw a number of food shelves experiencing higher needs. And so that was one thing that we saw coming out of around 2023. So ever since then, the need has been significantly higher. So I think the rising costs of food is a big factor.
Thank you, Madam Chair.
Senator Curran?
Good.
Senator Abler?
Well, thank you. So I just to get the numbers clear. Did you say that there's $230 billion in SNAP federally, and then they have to cut $1 billion? Did I hear that right?
Mr. Radvold?
Madam Chair, Senator Abler, the range of cuts, the possibility of the range is $1 to $230 billion. The instructions given by the Senate Budget Committee to the Senate Agriculture Committee was to find at least $1 billion in savings in their budget area. But in the House, that number was at least $230 billion in savings.
All right.
Senator Abler?
And so how big is the whole bunch? Maybe we could, it's interesting to me. So I mean, 1 billion out of 230 is, so how big is the whole ag budget then that they're trying to shave $1 billion out of?
Mr. Radbold?
Madam Chair, Senator Abler, a $230 billion cut would be about 20% of total SNAP spending. The vast majority of the Farm Bill is federal nutrition program, is spent on federal nutrition programs, SNAP being the largest. There's also the Emergency Food Assistance Program, which food banks like ours rely on to get food, federal commodities to our food banks and out to food shelves. There's the Commodity Supplemental Food Program, which is senior nutrition boxes that provides additional food for low-income seniors. And there's the local food purchase agreement program. So there are a number of federal nutrition programs that we rely on, but SNAP by far serves more people throughout the country than any of those programs combined.
Yeah, no, thanks, Madam
Senator
Chair. So
Abler.
I was just asking, though, so the entire budget for that committee is over $1 trillion then? And I mean, the whole budget for the feds used to be like under $3 trillion altogether, and then Human Services has exploded. And so, I mean, we're all kind of worried about this, but I mean, we just raised the level in Minnesota under my gavel, with part of our negotiations, up to 200% from, was it 133 or something for SNAP? Do you know how much? I mean, I'm not there. I wish I could be there because in 2011 we sat down in a really collaborative way and found a way to shave $1 billion out of the Human Services budget and weathered a really bad storm. And I wrote an op-ed about it, just trying to encourage us how we might go about this. At some point, $36 trillion is a lot of money. And when we were short $8 trillion, I said, this is going to be a problem. But I was wrong. $8 trillion was not a problem. At some point, when we're borrowing money from people who don't like our country, that, you know, it comes to roost. But there's a thoughtful way to do this where we focus on what's essential, what's important, and what's nice. And I think feeding hungry people is really a very important thing that we should be doing, and we agree about that. So anyway, so maybe if you could just at some point tell me when we raised the number, was it 133 to 200, it cost the state about $50,000, and the rest of it was free. But it wasn't free. It cost somebody some money. So would it be helpful to know, I'd like to know when we did that, how much did it cost the feds for us to take care of this extra population group? And that would just be, that's my question. So thank you.
Mr. Wojtak?
Yeah, Chair and Senator Abler, that's a really good question. I don't have the data offhand, but and maybe our folks at Children, Youth, and Families can pull that quickly. But yeah, I think that's it's helped a number of people, but it wasn't going to be in the hundreds of thousands, right? Probably around at least over 5,000 people that were on that edge of qualifying for a SNAP. So whatever that, doing the math, my math would be difficult to do, but yeah, all federally benefited. So yes, it was a good investment for the state because we were able to help more people out and bring in more federal dollars to help them out.
That's good enough, ma'am. Thanks.
Okay. Any other questions, comments? I just had one question for you, Mr. Wojtak, about the food shelf program. For that state grant program, how do entities, do they go about planning for that with a once-a-year application then for a grant? Or is it something that they have to do multiple times per year, or are there limits on that? If you could just tell me a little bit more about that, I'd appreciate it. Thanks. Yeah. Mr. Wojtak.
Yeah, thank you, Madam Chair. Yes, it is all the food shelves, so it's non-competitive. All the food shelves apply for that each once a year. And so that grant dollars go out once a year, and then they do a report on it, and then they also submit stats to the food banks each year. So that's how that's collected, through the report, through the stats, and that's how they calculate the benefit amount and how much each food shelf is getting. But yes, it is a once a year grant, and then they apply and do a report. So
Thank you. I guess I don't see any more questions for you. Thank you very much for these presentations. It's helpful to get an overview and help some thoughts about what we're looking at going forward. So thank you for your time today.
Thank you, Madam Chair.
Thanks so much.
And now we'll move to Senate File 849. Senator Maye Quade.
Good morning, Madam Chair.
Welcome to the committee, and please go ahead and present your bill.
Thank you so much. Good morning, Madam Chair, members of the committee. Before we begin, I do have an A1 amendment that gets the bill in the shape I want, if somebody wanted to move that.
Yeah, I just noticed that. Senator Mann, would you move the A1 amendment?
So moved.
Members, all in favor of the A1 amendment, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Thank you, and now you can proceed.
Thank you, Madam Chair and members. As amended before you today is Senate File 849, which would allocate $1 million this biennium, $500,000 in 26 and $500,000 in 27 for SNAP outreach. As you heard about, funding is especially important at a time when 1 in 5 Minnesotans are experiencing food insecurity and food prices are skyrocketing. Over 435,000 Minnesotans rely on SNAP to meet their daily needs. 65% of these households have children, and 33% are in households with seniors or individuals with disability. This is an issue that touches Minnesotans regardless of age, race, ability, or location. In 2023, the legislature created SNAP Outreach to support the work of organizations across the state that help enroll eligible individuals in SNAP because challenges that participants face include complex application processes, limited outreach in rural areas, and language barriers. Continued support of this program will help more Minnesotans access the resources they need for themselves and their family. I don't think I could say anything more than what was put in this presentation. This is just a really critical and important piece of our funding for the food security network. Thank you.
Great, and we have some testifiers here. First, I have Mesa Siebert. Welcome to the committee, and please state your name for the record and begin your testimony.
Thank you, Madam Chair. My name is Mesa Siebert, and I am the Neighbor Services Outreach Manager at Second Harvest Heartland Food Bank. And we are pleased to support SF 849, which will support organizations across the state that provide education, information, and assistance to Minnesotans applying for the Supplemental Nutrition Assistance Program, or SNAP. SNAP dollars are largely spent at local grocery stores, markets, and small businesses. And for every 1 meal a food bank provides, SNAP provides 9. It's the most efficient anti-hunger program in the country. But too many are unaware of its benefits or unable to access them. In fact, Minnesota ranks 35th in the nation, or 35th out of 50 states in SNAP participation for eligible people. Even Wisconsin is beating us, coming in at 11th place. But ultimately, we are leaving federal dollars on the table, dollars which are largely spent in local communities and benefit local businesses and boost local economies. I manage a SNAP outreach team, and we're one of about 29 other SNAP grantees in the state. Together, we cover 87 counties in all of Minnesota, and my team helps inform and educate Minnesotans on all things SNAP related. We explain the complex 10-page combined application form. We help break down stigma around the program, and we address misunderstandings about policy or procedure regarding SNAP. In 2024, my team conducted over 200 outreach events and presentations. This helped drive the more than 17,000 inquiries to our care center for food support. We were able to assist more than 8,500 Minnesotans with SNAP last year. That's an increase of 20% over the year before. However, there are still many barriers standing between our community members and SNAP access. We need to fund local organizations who have a unique insight and understanding of their immediate communities and can support outreach efforts. SF 849 would address this by avoiding a SNAP outreach funding cliff this summer, and we respectfully ask for your support. Thank you so much for your time.
Thank you. Next, I have Janet, and is it Gracia? Gracia? I'm sorry if I'm mispronouncing your name, but Welcome to the
Good
committee. And
morning.
please state your name for the record. And
Sliding
and
away. My name is Janet Gracia, and I am the president and CEO of Neighborhood House. My notes just went away. I serve as the president and CEO of Neighborhood House in St. Paul. We provide basic needs to over 30,000 individuals are impacted through basic needs through our organization. The need for food support, as it's been talked about a lot today, is greater than ever. Over the past year, Neighborhood House distributed over 47% more food than we did the previous year, and we do not see that slowing down. At Neighborhood House, we meet families where they are, offering fresh produce distributions, food markets, and essential services. With this increased use of the food market and the number of families needing more food, we are finding that many of the individuals visiting our food market have had a very difficult time or do not understand the application process for SNAP benefits. So we are actually an organization. We have a SNAP outreach specialist at Neighborhood House, and they assist in things like language, barriers around language, digital literacy, and a complex application process that prevent them from gaining these benefits, which would make a really big impact in their home with food stability. By restoring the full funding to this program, Minnesota can maximize the federal dollars through a 50% USDA match, funds that would otherwise not come to Minnesota, ensure families have the support they need to complete applications and receive benefits, and again, to reiterate, to prevent that funding cliff that we are all so fearful of. We know that poverty is a daily reality for the people that Neighborhood House serves. 62% of all participating households are at or below 100% of the poverty level, and for those reporting income, 82% fall within that threshold. For these families, SNAP is not just a resource, it's a necessity. And as I wrap up, I just want to mention that food stability is the foundation of a household. Without it, everything else becomes more difficult. A parent who is hungry struggles to focus at work. A child without proper nutrition cannot learn and grow. A senior choosing between groceries and medication is at a greater health risk. Food insecurity doesn't exist in isolation. It makes families vulnerable to housing instability, poor health outcomes, and economic hardship. When families don't have enough to eat, their entire foundation is shaken. Investing in SNAP outreach isn't just about numbers, it's about ensuring that families, seniors, and children in our state have access to the nutrition they need to survive. I urge you to support this critical investment, and thank you for your time and consideration.
thank you very much. I appreciate it. Next, we have Steve Barthel from Grocers Association. Welcome to the committee, and please state your name for the record. And
Thank you. Good morning. Chair Wickland and members of the committee, my name is Steve Bartle. I'm Director of Government Relations with the Minnesota Grocers Association. The MGA has been representing Minnesota's food industry for over 125 years. We are the only trade association that represents Minnesota's food industry from farm to fork. Our membership consists of over 300 member companies, which operate more than 1,300 locations throughout the state. I'm here today to express our strong support for Senator Maye Quade's bill, which would help fund SNAP outreach efforts across the state. Our member companies are proud to collaborate with organizations such as Second Harvest and other local hunger relief partners, providing millions of pounds of food to those in need in their communities. However, we know that even with these efforts, many Minnesotans struggle to afford basic necessities, including putting food on the table. Hunger is not a partisan issue. More than half of Minnesota's SNAP recipients live outside the 7-county metro area. Increasing awareness of SNAP eligibility is crucial to ensure that more Minnesotans are accessing the resources available to them. SNAP spending is truly a win-win for the state. Families in need across receive essential nutritional support, and those benefits are spent at retailers across communities you all represent. The USDA estimates that for every dollar in SNAP benefits generate $1.50 in economic activity. Nationally, 12% of all grocery store spending comes from SNAP beneficiaries. In 2024, Minnesota SNAP recipients spent over $857 million with eligible retailers. It is estimated that about 75% of SNAP-eligible Minnesotans are enrolled. This means tens of thousands of Minnesotans are missing out on the benefits that they are eligible for. This bill would help ensure that more people are aware of their eligibility, benefiting both consumers and retailers in every community across the state. We thank Senator Maye Quade for bringing Senate File 849, and thank you for the opportunity to express our support. Thank you.
Thank you very much. Members, do you have any questions for the bill author or comments? Senator Utke.
Thank you, Madam Chair. I've got a couple of them that kind of all flow together. But first of all, this bill and a number of the bills that we've got ahead of us yet today all refer to the Commissioner of Children, Youth, and Families. Is this being moved from the previous agency into the new department, or are we duplicating any of these efforts?
Senator Maye Quade, I mean, go ahead.
Madam Chair, I would defer, but I think we're moving in, but I'll defer to
Ms.
staff.
Ms. Hoffman-Litchie.
Madam Chair, Senator Utke, these are being moved. They've been moved. The programs are not being duplicated. All of the economic assistance and food assistance programs are currently within the Department of Children, Youth, and Families.
Okay.
Senator Utke.
Thank you, Madam Chair. So that helps, because I was just making sure we aren't doing things from 4 different areas of the state here. And then this is just an additional funding. We've got a base funding amount currently in place, correct? And then this just adds on top of what we currently are spending.
Senator Maye Quade.
Thank you, Madam Chair. Senator Utke, this would actually prevent a cliff that we currently have. So right now it's funded at $1 million, and it would drop to $500,000. And so with the amended language, this would just bring it back up to that $1 million so that we don't drop off that cliff in 26-27.
Senator Utke.
Thank you.
Any other questions? Senator Curran.
Thank you, Madam Chair. Senator Maye Quade, the bill, just the basic appropriation, so it doesn't say anything about how it be assigned to the agency. One could imply that it's just additional funding for the agency to do the work that they're currently responsible for. So it is DCYF's or sole responsibility to do all that outreach and education. What do they currently spend outside of this additional funding for outreach? It is their primary responsibility.
Senator Maye Quade.
Thank you, Madam Chair, and Senator Curran. So the USDA SNAP outreach program has been in existence since about the mid-2000s, and so they provide a 50% reimbursement to organizations who participate in the SNAP outreach program, and there's no limit to how much the state can draw down for that. So by investing this additional $500,000, it'll be matched by $250,000 in federal funds, and so this really just allows us to reach that 25% of Minnesotans who are eligible for SNAP but are not currently enrolled, to make sure that we are, making sure people are more food secure.
Madam Chair, follow.
Senator Curran.
Thank you, Senator Maye Quade. And my point is that it's been their responsibility, and is their program effective, right? What are they doing as an agency? One, outreach. They have a whole county network and a wide variety. In this particular case, this appears to be, based on the testifiers, a whole host of nonprofit grants that will be issued. It doesn't say that in the bill, and it's not implied, so the average citizen doesn't have any idea what we're talking about. But this is just additional funding that will then be granted out by DCYF to a variety of nonprofits who apply for it. Is that correct?
Senator Maye Quade.
Thank you, Madam Chair, and Senator Curran. So this is actually to continue the SNAP outreach program. So organizations that receive the money to do SNAP outreach per the federal program will or be able to expand to more. And I think it's really important to note, too, that if you're, talking about a county, there are a lot of people who are hesitant to tell their government that they don't have enough food to feed their kids because they're worried their kids will get taken away. And so neighborhood organizations or organizations that you might be connected to through sense of identity or sense of hobby are a better way to get people connected to resources than the government is sometimes.
Thank you, Madam Chair.
Senator Coran?
And so with that, yes, there'll be grants to nonprofits.
Senator McQuaid?
Madam Chair, it might be more helpful for an organization to explain how they do this program.
Ms.
So we
Garcia?
have a half-time FTE at Neighborhood House that does this programming. We do not receive a grant to do that programming. It's absorbed into our normal operational budget. Where it does have a great impact on our organization is on the bottom line for our food distribution. As I mentioned, our food distribution from last year to this year has gone up over 47%. We actually, in this year, had to make an investment in a deficit budget, which we feel secure, but that's scary to us as a nonprofit to have a deficit budget this year. But we are committed to the families of Minnesota for food security. What we recognize as an organization to continually invest in the SNAP outreach stabilizes families more so that they can still access our food market, but perhaps not rely on it entirely for all of their food needs. I hope that helps kind of
Thank you, Madam Chair.
clarify.
Senator Coran?
So DCYF is providing funding to purchase food. You just said it's reducing your food costs. I'm just trying to figure out the flow of the money. That's it. It doesn't seem that complicated. If you're not getting a grant, right, you're not applying for grants under a traditional grant environment, how does it exactly help you lower your food costs?
Senator Coran, maybe we could see, would the Department of Children, Youth, and Families be able to address the question of, we established the
Madam Chair.
program in 2023. The SNAP outreach program is in existence. We created it to support the work of organizations helping enroll eligible individuals in SNAP. So that's what this bill accomplishes, is to provide more funding to that program. I guess if that's your question about how does the program distribute the money that is in that program, then it seems like the department is really more well-equipped to address that. So, Mr.
Madam Chair,
Dunn.
I can forego that question. We're good. But I do have a question, as long as Mr. Barthel's up there. Could you give us what's driven, you're a supplier, you're a grocer and a generous, or you represent them. What have been the greatest contributors in the cost increase or the reduction in the value of $1 to even supply the foods that we have today, not outside of the growing need, which kind of all ties together? So,
Mr. Bartel?
Sure. Thank you, Madam Chair. And Senator Coran, thank you for the question, and it is a good one. First off, I'll just say that if the committee would like to have, or any of you individually would like to have, meetings or discussions about some of the underlying causes of the price of food and increases, happy to do that at any point. I don't want to. Our focus here is to help our hunger support network folks today. I can say at a high level, I'll start off by saying that retailers in 2023 had a 1.6% profit margin. That was average. So any costs that are felt throughout the supply chain, ultimately, retailers are forced to either eat those costs or they end up on the cost of goods. What I've been hearing from our members is that the three largest areas are labor, energy, and the overall cost of food that they are supplying to their stores. So we've seen a double-digit increase in the cost of labor, probably a 25% increase in the cost of energy, and at least that in the cost of goods themselves.
Senator Coran? No? Any other questions, members, regarding this bill? Well, thank you very much for your testifiers today, Senator McQuaid, and your explanation. Any final comments?
No, Madam Chair, I hope that this committee is able to fund this bill. I think leaving federal money on the table, especially when it comes to hungry Minnesotans, is just a bad idea. So hopefully we can move forward with good ones.
Thank you. Yeah, it does seem like a good opportunity. So this bill will be laid over for possible inclusion.
Thank you.
Thank you.
And now we will move to Senator Boldon, Senate File 1348. And Senator Boldon, it looks like there is an A1 amendment. Is that an author's amendment you would like to adopt?
Yes, Madam Chair, it doesn't change the substance of the bill. It's merely technical.
Members, Senator Boldon moves the A1 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Senator Boldon.
Thank you, Madam Chair. Senate File 1348 would establish the Regional Food Bank Grants Program at the Department of Children, Youth, and Families and appropriate $10 million per year beginning in fiscal year 26. The funding included in this bill would be divided between the state's 6 food banks, and those are located in Rochester, Fargo-Moorhead, East Grand Forks, Brooklyn Park, Duluth, and New Hope, and any tribal nation who chooses to participate. This bill was funded last year at $5 million one time and was distributed among the 6 food banks that I just mentioned, serving all of Minnesota. Given the steep increase in demand since then, as we have been discussing this morning, and the addition of Minnesota's 11 tribal nations as eligible participants, the funding amount requested this time is $10 million per year. As we have discussed, Minnesotans are visiting food shelves at an increasing rate. Food shelves visits were almost 9 million times in 2024 for Minnesotans, which is 1.5 million more times than in 2023, which was the previous worst year on record for hunger in our state. So we are moving, those are increasing. Food shelves and food banks have been sounding alarm bells for 3 years as demand for emergency food assistance continues to rise while funding and food donations decline. Food banks form the backbone of the hunger relief system, but they currently receive no ongoing funding from the state. The Regional Food Bank Grants Program would provide new and reliable source of funding for these critical partners in the fight against hunger. Minnesotans' hunger relief network is at a breaking point after years of high and rising demand for emergency food. Food banks can stretch state dollars further because of their purchasing power, meaning more food. Much of it is sourced locally, and will make it to our neighbors' tables. These investments alone, to be clear, will not meet the entire need, but given the limited resources available this session, it would provide much needed food to our neighbors to help ensure that fewer people go hungry in our state tomorrow. Despite continued economic growth, hunger rates are at an all-time high, again, as we have discussed, and we have a responsibility to act. The investments made last session are helping, but more needs to be done. This legislation would make a meaningful difference for the hundreds of thousands of Minnesotans experiencing food insecurity. And I want to reiterate a comment that was made earlier that I think is worth underlining, that food security really is the foundation of security for families. If you don't have food security, it is difficult for many other things in your life to go right. And so this really is a very basic need that 20% at least of Minnesotans, are not meeting right now. So this gives us an opportunity to help them.
Great. Well, thank you. And we have 3 testifiers on Zoom. First, we have Dom Corbel. If you could please unmute and then state your name for the record and begin your testimony. And now we don't hear you. Are you unmuted? No. Well, we can hear him online. Let's see if we have technical assistance. Oh,
ask
there.
me to restart, Chair. Are we
Okay.
good?
Yes, now we can hear you.
Awesome. All right. Thank you, Chair Wickland, members of the committee, obviously Senator Boldon for bringing this legislation forward, this bill. I am Dom Corbel, the Executive Director of Community Pathways of Steele County, located in the great city of Owatonna. I joined today to support Senate File 1348, the Regional Food Bank Grants Appropriation. A little bit about what we've seen here in Owatonna. In 2024, we had 56,000 visits to our food shelf compared to 39,000 in 2023, a 43% increase. We served 4,300 families at least one time in our food shelf compared to 2,800 in 2023, a 35% increase, and we distributed to those families 2.3 million pounds of food here in Owatonna compared to 1.7 million pounds in 2023. We are only able to meet that level of need because of our regional food bank Channel 1. Their ability to provide us access to free and low-cost food options is the lifeline to the work we do. In fact, in 2024, 70% of the food we sourced to meet that 2.3 million pound demand came from our food bank in Rochester. They give us purchasing power at costs that we can't find in retail. We need them to access enough food. The funding in this bill is mission critical, not just in our fight against hunger here in Owatonna, but it's critical to the fight against hunger across the entire state of Minnesota. And I want to make a special comment. Last night, I went out to look at the bill online, and I looked up all of the co-authors that have joined Senator Boldon. And I have to tell you how powerful it was for me to see bipartisan support of this bill amongst the co-authors. In a world where a lot of things we disagree about, to know that hunger is not one of them, that we can come together to battle hunger with bills like Senate File 1348 is so important to me, doing the work on the ground with our staff and our volunteers and those we serve. So thank you to the co-authors and authors, Senators Boldon, Coleman, Gustafson, Housley, and Kupec. Like, we cannot do this work alone, and to know that you are there with us at the state legislature, at the Senate, doing this work is heartwarming, and it convinces me that we can indeed beat hunger in the state of Minnesota. So thank you, Chair Wickland, and the entire committee for the opportunity to speak today in support of this bill. As a food shelf leader, it is, as I said, mission critical. Thank you.
Thank you very much. Next, we have Virginia Witherspoon. If you could please unmute and then please state your name for the record and begin your testimony.
Good morning. Virginia Witherspoon, Executive Director at Channel 1 Regional Food Bank in Rochester. Thank you for having me today, Chair Wickland, Senator Bolton, and Senators. Facing a hunger crisis in southeast Minnesota. In our region, in partnership, Channel 1 distributed 18.9 million pounds of food in calendar year 2024. It was 14 million in 2023. That's a 35% increase year over year. When I started 7 years ago, we were barely distributing 10 million pounds, and we're doing that without a meaningful increase in staff. And thank goodness we were able to distribute this additional food because our entire region continues to see a record number of shoppers. Our region had a 32% increase in monthly household visits compared to 2023, and it's a 78% increase if you compare to 2022. And I should say that Channel 1's region is southeast Minnesota, except for the city of Rochester. It's considered completely rural by the USDA's definition. A really shocking thing is the number of new shoppers. We had a 40% increase in people who had never shopped before at our food shelf here on site at our warehouse, and a 68% increase if you compare that to 2022. So what we're seeing at the food shelf that we run and what is being seen across the state is people who have never needed help before, who because of the high cost of groceries and high cost of living need help. We were so grateful to get the ARPA funding last year from the state, that $5 million. And if we had not had that, we would not have had enough food. At the same time, when demand is increasing, we're seeing reduced donations. Between the first half of 2024 compared to the second half, our corporate donations are down 23%. And that's food we get from distribution centers, food manufacturers, growers, nonprofits, and transportation and trucking companies. Distribution centers alone was down 19%. And the donations that came in through the Minnesota Food Bank's collaboration, those are national donations we secured, those were down 25% between 2023 and 2024. We are pulling every lever that we can. Channel One completely rerouted our trucks that deliver across our 14-county region in order to be able to stop at more grocery stores, gas stations, and other retailers and pick up more food. By doing that, we increased our retail donations by 44%, but we can't do that again next year, and it's still not not enough food. We're making hard choices. We are not buying eggs anymore because the value isn't there, and we are worried about milk prices and if we'll be able to continue to buy enough milk for the region. We appreciate our grocery store partners and our corporate donors, but the food that we get through that is rescued, and as far as what it is, it can be a mixed bag. When we get funding from the state, we are able to buy those top four foods that shoppers really want. And based on the statewide survey, that's always produce, meat, milk, and eggs. That $5 million in ARPA funding averted a crisis, but we've still run a deficit budget for the past 3 years. Next year, I have to deliver a balanced budget to my board, and we'll have to tamp back on ordering food. Before we knew that we had the ARPA funding, we were planning that. If we have consistent funding, as this bill proposes, we can plan for the whole year, and there won't be ebbs and flows in the amount of food. So there won't be ebbs and flows of the food that our neighbors see on their tables. Because we're a food bank that also runs the largest food shelf outside the metro area, we see personally what people are going through. I can hear the shopping carts at our food shelf clicking underneath my office. Hopefully y'all can't hear that. And in 2024, that 40% of shoppers that came for the first time, those people are stressed out. These are folks who, before the grocery prices were like this, they probably would have put some cans in the company food drive or given Channel One $5, but now they find themselves in line for food. I also want to endorse Hunger Solutions bill to fund food shelves. Channel One runs a food shelf and a food bank, and we know that both organizations need funding. It takes equipment and staff to run a food shelf. Thank you so much for your consideration. I truly feel blessed to food bank in Minnesota and appreciate how supportive our legislature and state has been.
Thank you very much for your testimony. Next, we have Susie Novak. If you can unmute and please state your name for the record and begin your testimony.
Good morning. Thank you so much for having me today. I would echo everything Virginia just said. We work very closely with her. I'm Susie Novak, the Executive Director of North Country Food Bank in East Grand Forks. So North Country serves 21 counties in northwest and west central Minnesota. We have a large geographic service area and we're completely rural in nature. We work with 220 nonprofit agency partners across the region to feed hungry neighbors. Last year was the busiest in the history of our organization. Our distribution is up 20% overall, and the first quarter of this year, we are up another 13% quarter over quarter. Our agency partners are still seeing visits by hungry neighbors increase on average around 30%. And these are staggering numbers in the food bank world. The record high and still increasing need, along with the significantly increased costs of food, make it extremely difficult for us to keep up with demand with no assistance. We're doing everything we can, along with our Minnesota Food Bank partners, to source and distribute food throughout the state, but there's simply not enough food in the system to meet the rising demand. More funding is necessary, otherwise additional food will simply not be available to hungry neighbors. Unfortunately, there's still no end in sight to the increased number of neighbors needing help. I regularly receive calls from agency and program partners regarding food and funding concerns. For example, a partner backpack program in Bemidji anticipated serving 350 children and ended up with more than 650 children on the program. They didn't have the funding in place to serve nearly double the number of children anticipated, and they are asking us for help. And we have a mobile food distribution partner in Twin Valley, Minnesota. Recently, they contacted me with concerns about the number of families attending the distribution. It's a small town of about 700 people, but more than 150 families are showing up needing help on a regular basis. And like Virginia too, we have the trucking concerns. Agency partners that we used to deliver to once a month are now requesting 2 and 3 and 4 deliveries per month. It really tests our capacity and our ability to get the food out there. Community support and funding are key to helping make sure fewer neighbors have to go hungry. And many times I think people, especially in our part of the state, will say they don't hear much about the hunger issue. And I think perhaps this is because Minnesota food banks are well positioned, experienced, and adept at doing this work, and we work very well together. And because we have largely had to manage the need on our own in the past, however, now we're sounding the alarm and advising that we need some help, and that the current, never-before-seen level of need is going to exceed our capacity without additional support. There is no benefit to not feeding people. We have all had to miss a meal, but not knowing when you get to eat again is debilitating, and it's costly to a community. I always say if you're hungry, nothing else matters. And we appreciate you guys helping us and supporting this SF 1348 bill, because without it, we're not going to be able to meet the need across the region and the state.
Thank you very much for your testimony as well. And next, we have one person here, Mark Siebeneller. Welcome to the committee, and please state your name for the record and begin.
Good morning, and thank you to Senator Wickland and the committee. My name is Mark Siebeneller, and I'm representing the Lonsdale Area Food Shelf. And I came today to support both the Senator Mann and Senator Boldon's bills. The experience of the Lonsdale Food Shelf mirrors that of the food shelves throughout the state of Minnesota. In preparation, I compared our usage reports and financial reports from 2022 to 2024. And in all major metrics of usage, households served, pounds of food distributed, number of children served, we have more than doubled. It ranged between 100 and 120%. But the headwinds we face go much beyond the increase in usage. According to the USDA, food prices have risen 24% in the last 4 years, and that's something I'm sure you all notice in your own household budgets. The Lonsdale Food Shelf is an entirely volunteer-run organization, so we have no paid staff. We do not have the personnel or the expertise to do grant writing, so we do rely heavily on our Hunger Solutions grant. In 2024, our grant was approximately half of what it was in 2022. And we've also seen a precipitous drop in food available to purchase at discounted rates from our regional food bank. So we are left to buy a lot more groceries at full retail prices. I'm sure you can all see the combination of a doubling in usage, rising food costs, and diminishing grant money is putting tremendous pressure on our organization. Last year, we posted a deficit of nearly 17% of our budget. And fortunately for that year, we did have savings. But that is an unsustainable deficit that we cannot do any longer, absent cutting back on aid. Measured in dollars, the Lonsdale Food Shelf spent 265% more on food than it did in 2022. In conclusion, I do ask that you vote yes to these food shelf relief bills so we may continue to serve the hungry in Northwest Rice County. And I thank you again for this opportunity to speak to your committee.
Thank you very much. I appreciate it. That concludes the testifiers on the bill. Members, do you have any questions or comments for Senator Boldon? Senator Utke.
Thank you, Madam Chair. We heard from a number of testifiers about the vast increase in the number of visits. What are Minnesota's eligibility requirements for people to access these food shelves and, pick up food?
Senator Boldon.
Thank you, Madam Chair. Perhaps I'll defer to if one of our testifiers could speak to their process.
If there's a testifier online who would like to, Virginia Witherspoon, if you'd like to provide an answer.
Yes, thanks so much. So we can see people up to 300% of federal poverty, whereas SNAP is 200%. And that's critical right now because it's the people it's the working poor that are really needing help. And so when you come to a Minnesota food shelf, we ask you to declare your eligibility. We'll show you a chart that shows the number of people in your household and the max amount of money that you can make, and that's the state guideline from the Department of Youth and Family Services, and then you shop. Unlike SNAP, you can get food from a food shelf same day. It could take weeks or even months sometimes to get food stamps. And when you need food, you often need food now. An example that I really like to give about like what working people would be coming here, that's I guess specific to the Med City, Rochester, is a phlebotomist, a professional that draws blood and is always in demand here, and a paraprofessional at the schools also in demand. If they have 2 children and no daycare costs because they're working opposite shifts, that family of 4 still would not be able to afford their groceries based on simple cost of living. And they're not going to qualify for any social services, so we stand in that gap. And also the chart that Jack Rodvald presented from the hunger study shows that percentage of people that the food bank and food shelf system is keeping from going without, and those folks are included in that percentage.
Thank you. Senator Utke?
Thank you, Madam Chair. And the reason for that question was, we fully appreciate what the food banks do. They serve a huge purpose and a great need. But I do get comments and contacts that tell me, and it's not all the time, but I'm kind of wondering if what we just heard is across the state or not, because people are telling me how it's being abused. And if it's being abused by people that don't really deserve or, they're fully capable of buying their own food, and then we're taking it away from those that are truly in need. And it's just trying to balance that out and to make sure that we do have a process that we're serving those that are in need. And, there is probably there's no need for a response to that. That's just the stuff I hear. Hopefully we can take and put that into play and make sure that, once again, the dollars being appropriated are getting to the right sources.
Senator Boldon, did you?
Thank you, Madam Chair. Thank you, Senator Utke. I think, we have heard all morning the increased need, the increased demand across the state. There are folks with food insecurities in every one of our districts across the entire state. And I don't think, there is a stigma that still comes with food insecurity. And I don't think that there are folks who are seeking these services that don't need them. These are people in need. As was talked about, just how families are being squeezed right now. If we think about, increased costs for families, if we look at renters, over 50% of renters are housing burden, meaning they are paying more than 30% of their income towards rent. Of renters, 26% of renters pay more than 50% of their income towards rent. That's, if we look at healthcare costs, if we look at childcare costs, if families are paying for childcare, oftentimes that is 20, 30, 40, 50% of their income to childcare. So it is no surprise to me that with all of those increased costs, families are feeling squeezed. And, if you're paying 50% to your rent and 50% for childcare, what is left to buy groceries? Nothing. And so people are seeking these services because they need them and they deserve to have food on their table. And I'm really grateful for all of the work of all of these entities who are standing in that gap and meeting those needs. And the needs are vast, and we have a responsibility and an opportunity to help those hungry folks in every one of our districts.
Senator Utke, any further? Senator Curran.
Thank you, Madam Chair. Senator Boldon, the bill says to create regional grants. Is there an existing map that defines regions, or is this just going to be up to the commissioner of DCYF?
Senator Boldon.
Thank you, Madam Chair. Thank you for the question. So the funding, including in this bill, would be divided between the state's 6 food banks. And so that's what I mentioned in Rochester, Fargo-Moorhead, East Grand Forks, Brooklyn Park, Duluth, and New Hope. And so the funding will be split using an existing allocation formula and would be explicitly for the sourcing and distribution of food. The greatest need facing emergency hunger relief system, and the food would be made available to food shelves throughout the state then at no cost to them.
Thank you.
Senator Cran.
Thank you.
Any other questions? Not seeing any other questions. Senator Boldon, any final thoughts?
This is a needed program across the state, and we really have an opportunity to stand in that gap and help the food banks, the food shelves who are meeting these needs or attempting to meet these needs across our state.
Thank you. And yes, it does appear from your testifiers that there is a great need. Senate File 1348 will be laid over for possible inclusion. And next we have Senate File 1112, Senator Mann. Senate File 1112 is Minnesota Food Shelf Programs Appropriation.
Thank you, Madam Chair. Members, Senate File 1112 provides funding for the state's food shelf program. The Minnesota Food Shelf Program is the main source of support for many food shelves in Minnesota and is funded by the legislature. As we have heard, right now, food shelves across the state are relying on private donations, which wax and wane over time and makes meeting the needs of the community, which of course has risen, as we heard, much more difficult. I have a whole speech about the need, and I think we don't need to belabor that point. So with that, Madam Chair, we'll go to the testifiers.
Thank you. And let's go to the testifiers. We have two testifiers on Zoom. Michelle Ness, if you could unmute and please state your name for the record and begin your testimony.
Hi, my name is Michelle Ness. I'm the Executive Director at PRISM. I've been with the organization for 12 years. I also have a co-testifier who will share his lived experience when I'm complete. PRISM is a nonprofit social service agency located in Golden Valley, Minnesota. We're pleased to share our experience in providing hunger relief services to community members in need. During our last fiscal year, we provided almost 26,000 unique food shelf visits to community members experiencing food insecurity. Notably, 61% of these visits were from families who are visiting our food shelf for the very first time. This is a 42% increase in individuals and overall 54% increase in children that we served. In January, just this last month, we set a record with almost 6,000 individuals and 2,000 food shelf visits. This is a lot of people for a small organization to serve. We have a small staff, we have limited funds to be able to purchase from local food banks, and we rely on food rescue from local grocery stores and engaging the community with food drives. Sourcing the necessary quantity and quality of food to meet the need of our neighbors is truly a constant challenge. Funding from MFSP is an important foundation in our ability to source a variety of food in large quantities from local food banks. Frozen meats, dairy products such as eggs, milk, produce, and baking ingredients are core items available on our food shelf. Our visitors are seeking nutritious food to cook and to bake. Many program participants have shared stories of undergoing chemotherapy or radiation for treatment for cancer, and being advised by their doctors to eat more fruits and vegetables. These community members, medically unable to work, turn to nonprofit organizations like PRISM to help regain their health and their functioning. Our community increasingly relies on nonprofits to meet their most essential needs. Food shelves are well established and equipped to provide immediate vital services that ensure stability and promote healthy lives. As costs continue to rise, it's critical that funding for food shelves remain a priority. Thank you, and at this point, I'm going to turn over to my colleague who's going to share about his lived experience.
Thank you, and welcome to the committee, and please state your name for the record and begin.
Yes, hello, my name is Rick Asurik. I am food shelf logistics staff here at PRISM, and I just wanted to share my experience of working and visiting food shelves with you today. As a child, I remember growing up using a food shelf and how just a few bags of groceries would help my family out, and being a large family, that was very helpful. My mother would often go to bed hungry or eat one time a day just to make sure that we weren't going to bed without food in our stomachs. When I had a son, I started using benefits like SNAP and WIC and other things like that, but that still was not enough to supplement what we needed. So therefore, I turned to food shelves again as an adult. And then during COVID, when the pandemic hit, I worked a commission job, which money wasn't coming in for a lot of people. My son's mother lost her job as well. So I started coming back to like local farmers markets and using the SNAP market bucks, and that is where I discovered PRISM. And I went there using them from time to time, and I just loved what they stood for. So I became a volunteer, and then I decided, to volunteer more hours. And I don't know, it's kind of hard for me to share this, I'm sorry. But I just really liked what they stood for, was offered a job and became part of the organization. And now, I feel like it's very important for us to deal with and help families in need such as myself at that time. I just want to make it a great experience for everyone coming through the doors, and just make sure that they are welcome and they know that, even if you need a few bags of groceries here and there, that we are here to help you. And I just want to, thank you for your time.
Thank you very much. I appreciate your sharing your story with us. And now we have Michael Olson, who's online. If you could please unmute and state your name for the record and begin.
Let's see. Can you hear me now?
Yes.
Thank you. Thank you for having me. Michael Olson, I'm the Executive Director of the Bemidji Community Food Shelf in Bemidji, Minnesota. The food shelf, the Bemidji Community Food Shelf is 42 years old and is a nonprofit located in Bemidji. We consider ourselves an emergency food shelf and offer one visit a month to our clients. During 2024, we provided support to 42,531 people from 13,576 families. We supplied just short of 1 million pounds of food to our community, including Beltrami, Cass, Hubbard, and other surrounding counties, including Red Lake Nation. The value of that was about $1.7 million. For every dollar that we receive in support, we're able to provide $4 in support to people within our community. As of April of 2023, we saw a 60% increase in the amount of demand for services. Since then, we've been supporting 1,200 families a month who have come in for food support. Those families make up the following. There were 15,293 people who were under the age of 17, 22,000 people of 18 to 64, and a continually growing area for us, our seniors. We had 5,108 seniors come in for food support. Of those 42,000, we know that 2,200 came to us for the first time ever to our food shelf. 2024 or 2025 marks 42 years of service to our community. We have over 300 volunteers. 80 to 85% of our support comes from individual donors within the community. We operate 3 days a week, as I said before. The MFSP funding plays a critical role in our ability to meet the demands here in outstate Minnesota. Without it, we would not be able to completely service all the people that come in. And given what's coming up, or I guess what we see in the federal support and questions there, we're concerned about our ability to meet needs going forward. So this MFSP funding I think will play even a more critical role. We experienced a 12% increase last year, and we don't see that necessarily decreasing coming up in 2025. If you have any questions, I'd be glad to answer.
Thank you very much. And then in person, Carrie Thompson is here. Welcome to the committee, and please state your name for the record and begin.
Hi, thank you. My name is Carrie Thompson, and I'm the president and CEO of Veep. Veep is one of the larger food pantries in the Twin Cities metro area. We are located in Bloomington, Minnesota, and although we'll take people from all over the state, we primarily see folks from southern Hennepin County, so the cities of Edina, Bloomington, Richfield, and Minneapolis are primarily the people that come to visit us at Veep. We've been around for 50 years, providing food and basic needs, homelessness prevention, and case management services to the community. We, like everybody else, are seeing a tremendous increase in the number of people that are coming to us. Last year, we served almost 300,000 people at our food pantry, which is up about 140% increase over 3 years ago, where we served 100,000 people. So we're definitely seeing a lot of folks coming to us for help, just like all of the other people who have testified as well, my colleagues. The majority of the households that we see at Veep are married two-parent households who are working. We see a lot of multi-generational households and single persons, including seniors. Over 50% of the folks that we do serve are employed. 27% are retired or unable to work due to disability, and 23% are out of work but actively looking. 100% of those folks are very low to extremely low income. So they might be working, but they're piecemealing together 2 to 3 jobs sometimes to be able to afford some of those costs that we heard earlier in previous testimonies. The folks that we see generally work in the service industries, factory work, in the food service industries, construction, and healthcare. Again, about 90% of the folks that we serve are located in Hennepin County. And well, some of the things I wanted to talk about too is, while we are seeing the amount of people that we serve going up, the amount of food that's been available to us over the last couple of years has gone down. As other folks have testified, food donations are down, corporate donations are down, and we're also seeing some of these high costs of living affecting our donors as well. So donors who had historically given us at a certain level are coming to us stating that they cannot give at that same level because the cost of living for them has gone up. So what that means to us is we also, like some of the others, have decided to make an investment from some of our cash reserves this year towards the purchase of food, because the funding that we have right now does not cover the cost of food for the amount of people that are coming to us. We have folks waiting 2.5 to 3 weeks to get food from us because we just don't have the capacity to see any more people than we already are. So we provide all of those food services through an on-site food pantry that's located in Bloomington. We have a mobile pantry service that has dozens of locations throughout the Twin Cities, pop-up distribution sites as well. We provided last year almost 5,000 food deliveries to seniors or folks on disability or people who are unable to drive due to medical reasons. And then we work with 3 school districts on a student hunger program as well to provide food to 12 different schools within those school districts to help stock a food pantry within the school as well. We provide weekend backpacks to students who wouldn't have the opportunity to have food over the weekends, who might access food through the school otherwise. So we, as I said, we are very much in support of Senator Mann's bill and SF 112, and we would definitely support additional food shelf program funding.
Thank you very much. And last, I have Yvette Azea Martinez. Welcome to the committee, and please state your name for the record and begin.
Good morning. Thank you, Madam Chair and members of the committee. My name is Yvette Isea Martinez, and I serve as the Senior Officer of Advocacy at Greater Twin Cities United Way. We do not have a food shelf. We're also not a food bank. What we do have is a statewide helpline that helps connect community members, individuals, to resources available in the community. In 2024, we made, through our helpline, 15,309 referrals related to food security across the state of Minnesota. This represents a 4% increase in referrals compared to 2023. Out of these referrals, over 1,700 were from Greater Minnesota. Since 2021, we have observed an overall 57% increase in call referrals regarding food security. This does not include calls specifically related to SNAP because those are considered public services, so they do get tracked different. So this is 57% increase in individuals calling, asking for help on how to access food. I think you've heard many times that 1 in 5 Minnesota families are experiencing food security. I also want to highlight the realities of seniors. Seniors facing food insecurity often wrestle between the high cost of medicine and healthcare, forcing them to choose between paying bills and buying nutritious meals. This one is very personal to me. Just 2 days ago, I had to hear my mom decide between buying her prescription and being able to afford food. My mom is 72, forcibly retired. Sorry, didn't expect to get emotional. She's never depended on anyone. Certainly doesn't want to depend on me. She has not signed up for SNAP because she does not want to depend on the government. But the reality is that if she doesn't visit a food shelf, she's not able to get the food that she needs for her chronic illness that she acquired while working as a CNA for over 15 years. My mom is a prideful, strong, head-well woman that does not want to depend on anyone, but she does need access to products and healthy meals in order to stay healthy. And she's often having to choose between her medications and being able to afford food. So I will encourage anyone who questions whether or not the services are being abused to visit any of the food distributions in Dakota County, specifically the one connected to Open Door, on a Wednesday afternoon, because the site is a sore one to bear. You will see a line of seniors, whistle workers, canes that can barely stand up in line to gather food. Among them, my mom, which many times I almost have to force to go, and she only gets to go once a month. And if you're wondering in the amount of veggies that she can get about 2 potatoes and 3 tomatoes for a whole month, just to put it into perspective. And perhaps that is more information that you bargained for this morning, but that's why I'm here. I'm here both represented Greater Twin Cities United Way, but I'm also as a citizen, as a community member, and as a daughter who's seen the need in my mom, a need that she did not expect, a need that she did not want, and that it became a reality because of a work injury and having to forcibly retire. Greater Twin Cities United Way greatly supports all of the bills being presented in front of you today because they're all interconnected. If we want to make a change, if we really want to accomplish change, then every single one of them needs to be passed because one without the other is really not going to go too far. Thank you so much for your time.
Thank you very much for sharing. Members, do you have any questions? Senator Utke.
Thank you, Madam Chair. How are these monies distributed amongst our food shelves across the state? Is there a formula? Is there a process so that they're all treated equally, so to speak, with the volume of business that they do?
Senator Mann.
Madam Chair, Senator. So it's in statute how the money is distributed. It's based on the proportion in proportion to the number of individuals served by each program. And 96% of the money has to be used in purchase, transport, coordination, and distribution of food, with only 4% used on admin costs.
Senator Edke?
Thank you, Madam Chair. One additional question. We've got $4 million per year appropriation. That is on top of the base. Do you know what the current base is?
Senator Mann?
Madam Chair, I don't know if council has that answer.
I don't know. Mr. Vessel, do you know the base for that? I don't know if I have it.
Madam Chair and Senator Utke, if my memory serves correctly, it's about $4.7 million per year.
Senator Edke?
Thank you. That's all.
Any other questions, comments? Senator Mann, any final comments?
No, Madam Chair.
Thank you. Well, I really appreciate your bringing this bill forward and appreciate all your testifiers. This will, Senate File 1112 as amended, or no, that one isn't amended, will be laid over for possible inclusion. And now Senator Mann is presenting Senate File 1110.
Madam Chair, members, Senate File 1110 would increase the SNAP minimum benefits for seniors. Currently, the monthly minimum benefit level for SNAP is $23 per day. Older adults are among the most vulnerable population when it comes to food insecurity because they live on a fixed income, and as we just heard, it's quite tragic that we have people who have contributed their entire lives to their communities and now struggle to put food on the table as prices of housing and their medications continue to increase. Food shelf visits for seniors have increased 115% since 2021, so we do need to act. Madam Chair, I do have an amendment today. It changes the age from 55 to 60 to comply with federal definitions and removes a line about the commissioner having the authority to change the minimum benefit since it's set by the USDA, and this kind of creates confusions.
Senator Mann moves the A1 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The amendment is adopted. Senator Mann, did you complete your testimony?
Yes, Madam Chair.
Then we have Peter Wojtak as a testifier. Please state your name for the record and begin.
Thank you, Madam Chair, members. Peter Wojtak again with Government Relations Manager with the Food Group. Here to testify in support of increasing SNAP, or the Supplemental Nutrition Assistance Program, minimum benefit for seniors in our state. As Senator Mann mentioned, the current minimum is only $23 a month, and while this program is a vital resource for many people, the reality is $23 barely scratches the surface of what is needed to ensure our seniors can afford nutritious food. And we believe this increase is not just necessary, but critical for the well-being of our elderly population, as senior visits have risen significantly since 2021. Many seniors in Minnesota live on fixed incomes and often struggling to make ends meet with the rising costs of living. Food, housing, healthcare, that $23 simply falls short of providing nutritional support that our seniors need and deserve, and at this level find it extremely challenging to buy nutritious foods. Consider the cost of fresh fruits and vegetables, lean proteins and grains. A single meal featuring healthy ingredients can quickly deplete this modest allowance, forcing seniors to make those difficult choices between quality and quantity, often having to sacrifice nutritional value to stretch their limited budget. So an increase to $50 would help alleviate some of that financial burden on these individuals and ensure they have access to nutritious food, maintain good health and quality of life. And for seniors, proper nutrition is even more critical, as it helps prevent chronic diseases, support mental health, and promoting overall well-being. By increasing SNAP minimum benefit, we can directly impact the lives of thousands of seniors, allowing them to live with dignity and independence. And lastly, just mention the economic impact can't be overlooked, as increasing SNAP benefits will lead to higher spending in local grocery stores, farmers markets, and supporting our local economy and small businesses. So it's a win-win situation for both our seniors and the community. So I just urge your support for the bill. Thank you.
Thank you. Next, we'll go to a testifier on Zoom, Rhonda Elstead. If you could please unmute and then begin your testimony? Rhonda, are you available? And then if you can unmute and turn on your video. Yeah, we'll try coming back to her in case she's having technical difficulties. Next, I have Sarah Gangelhoff. Welcome to the committee, and please state your name for the record and begin.
Yes, thank you. Chair Wickland, members of the committee, my name is Sarah Gangelhoff, and I'm the Director of Advocacy and Innovation at the Women's Foundation of Minnesota. We're here this morning to support Senate File 1110. I'm also personally pleased to see that the senator from my district, Senator Abler, has signed on to this bill. So thank you, Senator. In the past 42 years, the Women's Foundation of Minnesota has invested more than $54 million in communities across Minnesota and advanced policy to create a state where women, girls, and their families thrive. Every 2 years, in partnership with the University of Minnesota, we release research on how women and girls are faring here. In our 2024 Status of Women and Girls report, we explore the barriers and systemic issues that many women and girls in Minnesota face, including food insecurity and poverty. We're here to talk about the Minnesota senior women who would benefit from a SNAP increase and put some numbers to the need. On the surface, food insecurity for seniors may not seem like a woman's issue. However, we found that for older women, food insecurity is often coupled with other issues that exacerbate the impact. To begin with, Minnesota has more aging women than men. Women are also more likely to be impoverished at age 65 and older. Women comprise 54% of the population of Minnesotans over 65, and older women of color and older women with disabilities are disproportionately food insecure. Overall, in Minnesota, about 71% of participants in supplemental nutritional assistance programs are women. 17% of Black women, 16% of Latinas, and 6.4% of white women over 50 years old in the U.S. reported not having enough food to eat in the last 7 days. For Minnesota's Black and Asian women, 65 and over, they're more likely than men to be managing at least one disability, and older women with disabilities report high rates of food insecurity in the U.S. Additionally, being food insecure also creates health risks for this vulnerable senior population. The National Coalition on Aging cites effects such as low nutrient intakes, higher risk of diabetes, congestive heart failure, high blood pressure, asthma, gum disease, mental health issues, and medication non-adherence, as when seniors may be forced to choose between medication and food, like you've heard multiple times today. As you also heard from this morning's presentation, investment in food security is an investment in our state's economy and in the health of seniors. But the bottom line is seniors are going hungry in our state. That's a fact. And the current monthly minimum is inadequate. Our own DEED website calls our state a food production and agricultural powerhouse. There's no reason anyone should go hungry here. We ask you to support Senate File 1110 and increase the minimum benefit for our senior community. Thank you.
Thank you very much. Now let's see if Rhonda Elstead, if you are available, please state your name and proceed with your testimony.
Can you hear me now?
Yes, we can.
Hi, my name is Rhonda Elstead. I want to thank the member chair and members for allowing me the opportunity to testify today. I am a 65 or coming up on 65-year-old native Minnesota, living in Duluth, Minnesota. I receive SSI and disability, which means I have a limited income. I depend upon my SNAP. Whatever the dollar amount is, I depend upon it. When I go grocery shopping, I may have a list, but I don't always get what I want on the list or what I need. I'm glad at this time that I don't have health issues that may allow me to, would need me to purchase foods for that. I'm lucky enough that I don't have those health issues, but what I don't have is the food. I don't have choices. I am now becoming dependent on food shelves, and more dependent on food shelves, which is another whole sad affair. At 65, this is not what I expected my life to be. My rent went up $35 this year. I don't know what the utilities will be. The colder it gets, the more gas goes up. Gas prices are going up. Food prices are going up. I don't even purchase eggs anymore because they're just too expensive. And, you know, eggs are put into everything you make now. So it's becoming more and more of a hardship. Again, this is not what I expected to be at 65. I thought I'd be going into my golden years. I did not think that food insecurity would be such a big part of my life. I'm wondering what I'm going to make for a meal, wondering what I'm going to make next week, wondering what this month is going to look like. And right now, the way the economy is, nothing is going to come back down. It's going to go up, it's going to stop, and that's where the prices are going to be at. And we're going to be paying for it, whether we can afford it or not. And what that'll mean is that we won't be buying fresh produce. We won't be buying meat. We definitely won't be buying eggs, milk, some of the basic necessities that we need, we won't be buying. I don't know what we'll be doing, but it's becoming, for me, a sadder state of affairs to be looking at as a 65-year-old. I thought things would be better now. I don't know what I thought, actually. I thought things would be better at 65. Food insecurity is a daily thing. You have to eat every single day. It's one of the basic needs that a human being has to have to survive. Raising it from $23 to $50 would mean it's only, somebody might think that's not a lot, but it is to us. The ones that need it, every single dollar helps. And I can't emphasize enough, every single dollar helps. Please increase this amount to $50. Please allow the seniors a little more dignity, a little more choices, a little more freedom. And thank you for your time.
Thank you very much for your testimony. I have Steve Bartel on the list. Do you have, can you give just brief testimony to this bill since you have spoken regarding another bill? So if you can limit the time, I would appreciate it because we have one more bill to hear.
Yes, Madam Chair, thank you again. Steve Bartle, Director of Government Relations with the Minnesota Grocers Association. I will just echo some of the comments that I made before, that we are in strong support of Senator Mann's bill to increase the funding for seniors to $50. It helps seniors, it helps businesses all across the state. So I will leave it with that, and thank you for your time.
Thank you, I appreciate it. Next, I have Thomas Elness. If you can state your name for the record and begin.
Yes, thank you. Good morning, Madam Chair. My name is Thomas Elness. I'm the new State Advocacy Director with AARP Minnesota, representing more than 620,000 members across the state, and I will be brief as well. Access to adequate and nutritious diets is foundational to maintaining health, quality of life, and independence as people age. Older Minnesotans who are food insecure are more likely than their food secure counterparts to have limitations to their activities of daily living, have conditions like diabetes and depression, and experience heart attacks. Many seniors live on fixed incomes and may struggle to afford food. Recent data from the AARP Public Policy Institute found 3 key findings that I hope I can share with you today. Adults age 60 and older make up a growing share of SNAP participants, but remain the most under-enrolled population. Most older SNAP participants live alone, and nearly half of participants aged 50 to 59 have a disability. Nationally, almost half of all SNAP households include at least one adult age 50 or older. It's our strong belief that no one should be hungry. Hunger is not a political issue, but a daily reality for many people in Minnesota. Senate File 1110 will serve to reduce food insecurity for thousands of older Minnesotans, and we appreciate your consideration. Thank you.
Thank you for your testimony. Members, do you have any questions or comments for Senator Mann's bill? Senator Utke.
Thank you, Madam Chair. Just a little bit of clarity on this. Do we know how many seniors currently access SNAP? And then how would this bill affect that? It's going to allow more to access it, or just they get to access additional funding. But I think all these things would end up in a fiscal note, but I'm sure we don't have that yet, so just wondering.
Senator Mann?
Madam Chair, I don't have that number. I'm sure somebody out here does.
Maybe Mr. Wojtak, can you address the question?
Yeah, thank you, Madam Chair and Senator Aki. So for this specific bill, I believe from data that we have, it would be around 17,000 seniors that would be impacted at that minimum benefit level. And so it would be using state funds to supplement the federal funds that currently exist of $23, raising it to $50 for those individuals.
Senator Utke?
That's all. Thank you.
Okay. Any other questions? Well, seeing none, Senator Mann, do you have any final comments?
Yeah, Madam Chair. So we have an aging population, so this problem is just going to continue to get worse as time goes by. And I think we heard from one of our testifiers, when we invest in food security, when we put in $1, we get out 4. So not only is it a really important investment, it's also very cost effective. And the other thing I heard from another testifier today that kind of stayed with me is that nobody wins when people go hungry. So I hope that we make some investments, Madam Chair.
Thank you. Yeah, it's clear that there is a need and it is growing. Members, we will lay Senate File 1110 as amended over for possible inclusion. And our last bill on the agenda is Senator Kupec, Senate File 1412.
Madam Chair.
Senator Abler.
Just while he's coming, I enjoyed the interaction in the beginning of the hearing, but we were talking about numbers, and it's like $18 billion a year for SNAP annually. But just if we could all get in the same frame of what period we're talking about, or just if people can help us, the $1 trillion 3 is over 10 years. And so just as we discuss this, that's just an encouragement to us, and not always easy to know what time frame we're talking in. So thank you.
Yeah. Senator Kupec.
Thank you, Madam Chair. I do have an A1 amendment that I would like to move.
And that will be passed out right now.
And I can quickly just speak to it. It does put a number on the bill in terms of a dollar amount, and then there's a couple of other just pretty much just technical minor changes, adding some commas, fixing a couple of words.
Okay. Senator Kupec moves the A1 amendment. Members, all those in favor, please signify by saying aye. 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 Any opposed? The amendment is adopted. Senator Kupec.
Sure, thank you. Kind of finishing up with a slightly more unique program here, but in the same vein of everything we've been talking about today. This is a bill for prepared meals, establishing a grant program. The program is aimed at providing hunger relief to Minnesotans experiencing food insecurity, particularly those who face challenges in preparing meals due to limited mobility, disability, or resources. The program specifically serves individuals 18 to 60 and their dependents, making it one of the few hunger relief programs not targeted towards either children or seniors by design. Eligible grantees include nonprofit organizations, federally recognized American Indian tribes, or bands in Minnesota with a proven track record of delivering culturally, religiously, and dietarily tailored prepared meals. These meals must be prepared in a licensed commercial kitchen and distributed following ServSafe guidelines. In 2023, we did fund this program with a one-time fund of $3.4 million. This legislation would make a meaningful difference for tens of thousands of Minnesotans who experience food insecurity, especially those who are unable to access other types of assistance and who cannot prepare food from a food shelf due to a lack of access to a kitchen or the physical ability to cook, and perhaps because they are in a time of crisis. And I do have a couple of testifiers.
Yeah, and I have Lisa Lane. And Eric Hedman could come up as well. And since we are running short a bit on time, if someone has addressed some of your points, if you can stick to the things that are unique about this program, I'd appreciate it. And Ms. Lane, please state your name for the record and begin.
Senator Wicklund and members of the committee, thank you for the opportunity to testify today in support of Senate File 1412. My name is Lisa Lane, and I represent Open Arms of Minnesota, a nonprofit meal provider that serves medically tailored meals to critically and chronically ill individuals who are also food insecure. This legislation represents a forward-thinking approach to addressing food insecurity in Minnesota, and it addresses a significant gap in our current food support system by providing access to nutritious, and in our case, medically tailored meals for vulnerable populations. This program has allowed Open Arms to serve people who have reduced access to food and limited mobility and therefore face multiple barriers to preparing food themselves. In fact, 65% of our clients rely solely on our prepared meals for 100% of their weekly food. A great example of our success is from our 57-year-old critically ill client in Duluth who shared, "Thank you very much for the meals provided. I've lost 30 pounds necessary from eating the meals, and that, combined with my medical care, has resolved my hip and knee problems." The impact of not passing this bill will mean we need to immediately decrease approximately 120,000 meals from our budget. Current data from Minnesota hospitals reveals a substantial burden of food insecurity among critically ill individuals in Minnesota is particularly acute. 67% of critically ill patients in Minnesota report food insecurity during treatment. 82% of cancer patients experience nutritional challenges during treatment. Approximately 28,000 Minnesotans undergoing active cancer treatment struggle with meal preparation, and 73% of critically ill patients report missing meals due to lack of energy to prepare food. Studies have also shown the important role that nutritious medically tailored meals can play in a patient's recovery process. Medical facilities report a 45% readmission rate for critically ill patients who lack adequate nutrition support. And 89% of healthcare providers indicate that proper nutrition through prepared meals could reduce treatment complications. This bill will further improve health outcomes and reduce healthcare costs while ensuring our most vulnerable residents have access to nutritious food. The impact on critically ill Minnesotans will be particularly significant, potentially transforming their treatment outcomes and recovery process. I strongly encourage your support for this bill and thank you for your consideration.
Thank you very much for your testimony. Mr. Hedman, if you could please state your name for the record and begin.
Thank you, Madam Chair and members. My name is Eric Hedman, and I'm the Prairie 5 Meals Director who was contracted to provide the prepared meals for Minnesotans experiencing the food insecurity and also the difficulty of preparing their own meals due to limited mobility, disability, age, and also limited resources. Maria called the Prairie 5 office and asked about the prepared meals program. She stated her doctor made her aware of the program and spoke about how her family was recovering from COVID. Her family's needs for this was urgent. She needed food. She said that they hadn't eaten in 2 days. Complicating their problem, they do not have their own transportation. Prairie 5 has a long history of working with many partners and we also believe in not duplicating of services. For the Prepared Meals Program, we contacted the school districts, churches, clinics, family services, public health, homeless shelter programs, and also our food shelves. Participants could sign up by either calling our main office or else they could sign up online. We also have 3 hot coal trucks that deliver these meals around in the 5-county area. The Prepared Meals Program also works nicely with the Senior Nutrition Program. 65% of the communities in Big Stone, Chippewa, Lacaparo, Swift, and Yellow Medicine County have a population of under 500 people. We all know that living in smaller rural communities, they lack access to grocery stores, C-stores, and also some other essential services. Food insecurity is a major issue in rural Minnesota. In western Minnesota, people may have to drive 11 miles to the closest grocery store. In 2024, with the Prepared Meals Program that Prairie 5 Meals served, we served 10,341 meals to 505 duplicated households. That equates to 1,616 individuals. 56% of those participants were the age of 18 to 60. 41% were from 0 to 17, and 3 were to 61 and older. Since Prairie 5 also manages food shelves, 164 of those households also combined using the food shelf as well as the prepared meals program. Minnesota believes in investing in the lives of people. Living in these uncertain financial times, this pilot program has shown itself to be sustainable and also supplementing the families throughout the rural area. Rather than placing barriers in the way of families, this program really needs to be refunded, allowing families to stop worrying about where their next meal will come from. I urge you to support the Senate File 1412. Thank you.
Thank you. And I have one more testifier on the list, Therese Hill. Welcome to the committee, and please state your name for the record and begin.
Awesome. My name is Therese Hill. I serve as the manager of Food as Medicine Strategy with Fairview Health Services. And thank you, Madam Chair and committee members, for the opportunity to testify today on Senate File 1412. Fairview has invested in food as medicine programs for more than 10 years. Programs and responses that recognize the healing power of food and harness that to nourish our patients, enrich community, and transform our systems. Our programs offer both immediate responses to patients that are experiencing the acute symptoms of food insecurity, while also investing in local organizations that are doing amazing work and working to transform our local food system by layering in elements like prioritizing local sourcing from BIPOC or emerging farmers, youth workforce development components, senior programs that are focused on social connectedness around food, and collaborating with organizations that are already doing incredible work to better expand their services and the reach and serve our patients and communities together. Last fall, we launched Fair Table, which is our food as medicine initiative that recommits or doubles down on our commitment to embedding healthy food access into the care that we offer to patients. Our programs include seasonal produce prescription boxes, shelf-stable food bags, food voucher programs, community-facing Eastside table work, as well as our medically tailored prepared meal program in partnership with Open Arms that we just heard from. And that's the reason I'm here today, and grateful to be able to share more. Fairview is fortunate to be a recipient of the current funding in the bill for our medically tailored prepared meal program. And these funds in partnership allowed Fairview to offer patients and their families that are experiencing significant barriers to accessing healthy food and preparing meals at home, as well as especially challenging health conditions, with a dignified and culturally meaningful meal delivery each week. Our specific program focuses on patients experiencing prediabetes or type 2 diabetes, as well as pregnant or postpartum individuals. Conditions that are known to lead to decrease in mobility, dexterity, energy, all things that are super important to grocery shopping and carrying heavy groceries, peeling and chopping vegetables, turning can openers, standing at stoves, let alone having access to a kitchen, stable housing, cooking equipment, and the ability to procure the healthy foods and then prepare them. So patients are identified by their primary or specialty care providers and referred to our food resource navigators. They have the capacity to get to know the patient, spend time, and connect them to programs, or resources, or responses that are most appropriate for their current situation or their condition. Patients, participating in the program include an 11-year-old girl who's was referred to the medically tailored prepared meal program, our food resource navigators, by her specialty provider at the pediatric diabetes clinic, experiencing severe obesity, sleep apnea, and uncontrolled type 2 diabetes as an 11-year-old. Her mom's also currently going through cancer treatment, and their family has incredibly limited income. So the ability to refer them and offer them prepared meals, home delivered, is impacting an 11-year-old's life to be able to improve health outcomes and make progress to feel good every day. Their families' 1,200 meals over the last 6 months are one part of the 20,000 that we've been able to distribute since our partnership started last year. We continue to hear from the patients and providers about the impact of this program and on their health and well-being, and we could not do the work without the support of our partners and this funding from DHS. So a huge thank you to Senator Kupec for championing this initiative and being part of the work to improve the health of our patients and communities across Minnesota.
Thank you. Members, do you have any questions? Senator Curran.
Madam Chair, I don't have a question. I do have an amendment.
Senator Curran has an amendment.
So I'd like to move the A2 amendment to Senate File 1412.
Thank you.
Madam Chair, I'm sure we can complete it in 20 minutes.
Okay.
No, it's a brief one.
If you would like to describe your amendment, it wasn't something I was aware of, so if you can describe that, and I don't know if Senator Kupec was aware of it, so go ahead.
Excellent. Thank you, Madam Chair. So it's a really simple amendment. We've had a constant battle with grants and specifically around this type of grant to food programs. So this one just eliminates an individual or nonprofit organization affiliated with Feeding Our Future is prohibited from receiving grant funds under this section. Really simple, and request a roll call. Thank you, Madam Chair.
Senator Kupec, do you have a response?
Sure. I don't really think it's necessary. I don't think anything, knowing how this grant program is done, I don't think anybody with Feeding Our Future would be eligible for this. So if you want it included and add extra language, that's fine, but I don't think anybody would be eligible anyway. So I'm neutral.
Okay. I'm not sure if the department would be willing to or able to comment on it just on the fly. I mean, whether it would be something that could be addressed in the language that you have it in. Oh, Mr. Dem, if
Madam Chair, members of the committee, for the record, Nick Dem with DCYF. Madam Chair, we would not have any concerns with adding this amendment.
any other questions about the amendment?
Yeah, Madam Chair, if that's the case, I'll retract my roll call and encourage a yes vote.
Okay, thank you. Members, any questions, comments about the amendment? Senator Kupec, any final questions?
Nope.
I guess it seems like this would be already covered, that we already would be having steps to prevent people who are not eligible from receiving grant funds. If Mr. Dem concurs that this is a feasible language, we will just take a vote on the amendment. And members, all those in favor, please signify by saying aye. Aye. Any opposed? The amendment is adopted. I should say the A2. Members, any other questions or comments? And seeing none, Senator Kupec, any final thoughts?
Sure. Just one, I know in my district, we have a nonprofit that deals with mental health issues, and they found that one of the big things dealing with mental health issues was food insecurity, and so they added a food pantry, and they have also benefited from this program of the prepared meals, because when people were in crisis just with mental health, they found this was a way. If you're worried, if you're stressed out with a mental health condition and you're trying to figure out also where your next meal is going to come from, that's one way you can take one thing, put something on the plate to take something off of their plate for their mental health. So it's a really good program. So thank you, Madam Chair. Thank you, committee.
Thank you, Senator Kupec. Yeah, it's great to hear about the results of the funding that we allocated towards it, and it does seem like it's serving kind of a unique need that isn't being fulfilled, and we do have such great needs in this area. So I appreciate your bringing the bill forward this session. And with that, Senate File 1412, as amended, will be laid over for possible inclusion. And we have reached the end of our agenda, and we are adjourned.